House Speaker Nancy Pelosi is drawing a line in the sand, saying that she won't pass a bill that doesn't include a public option. And now, while both parties are showing off their stubborn streaks, if you will, in the debate, a new poll shows that congressional Republicans are the ones worse for the wear. In fact, just 21% of Americans believe that congressional Republicans will make the right decision for the country's future. 35% have confidence in Democrats. Joining me now to talk about this and a number of other things, Republican Congressman and one of the 9 doctors in either the House or the Senate, Michael Burgess of Texas. Dr. Burgess, Congressman Burgess, good to see you, sir.
Good morning. Great to be with you.
Congressman Burgess, I want to ask you a little bit about the public option debate. We've seen a lot of pushback on by the Republicans about the public option. We also have seen some pushback even on the notion of co-ops. Is there a Republican alternative that both allows for near universal coverage, as President Obama has talked about, allows people not to be dumped off the rolls if they have pre-existing conditions, but also helps contain the cost over the long term? Is there an option? Is there an alternative that Republicans, including yourself, support versus the public option?
Sure. Short answer is yes, and short of the actual bill, which we do have, but our leadership has decided not to have us introduce it. But a number of issues that came up during the debate in my committee on just those very things. We didn't actually talk much about co-ops in the debate on the Energy and Commerce Committee. People have asked me about that. Sure, I'm in favor of purchasing cooperatives. I think that's a good idea. If we could let those exist across state lines, I'd be all for it. If the co-op idea is just simply the public option dressed up as a different entity, then probably not a lot of enthusiasm for it on my side.
Congressman Burgess, I want to bring in former New York Governor Mario Cuomo, who joins me here and obviously has thought about these various health care issues in a number of ways. Governor Cuomo, your thoughts as you hear Congressman Burgess talk about Republican alternatives?
Actually, I'm curious about 2 things. What about the Romney plan in Massachusetts? Now, there was a Republican governor who was very bold in what he did as a governor, and it's had a mixed kind of record so far, but is there anything there that the Republicans could use? And if you have a bill, why aren't you telling the people of America what is in that bill? What is the point of holding it?
Well, there are a couple of points that the governor raises, and of course, I do need to point out to the governor I like the Rangers' chances this year better than any in a long time. On the issue of the Republican alternative, there have been, and these are just strictly structural, it's been impossible to get anything through Legislative Council in the House of Representatives to get any type of score back from the Congressional Budget Office. Obviously, this is data that my leadership wants to see before they introduce the bill, just as they have done on the Senate side, just as they have done on the House side. If the cost and coverage numbers need some adjustment before the bill is introduced, yeah, we want the same privilege that the Democrats have to be able to make those adjustments. And then the other argument is, if the other side is actively committing suicide, you don't necessarily want to get between them and their weapon at that point. So, the town halls this summer have certainly demonstrated something to me, and that is the American people are really engaged in this process. Let's face it, the president's popularity is down, but it's as you point out correctly, it's a lot higher than the congressional Republican popularity. The president could have passed pretty much whatever health care bill he wanted to in February or March. Why there was not a bigger push to do it then, I don't know. Why they insisted on cap and trade in the summer in the House of Representatives, when members of the House took a tough vote on that, my opinion took the wrong vote on that, went home to face the constituents in their district, and were met with 2 questions. Next time, will you please read the bill?
Burgess, forgive me,
yes,
I just want to make sure, because I know we only have a minute left, I do want to get to the question about former Massachusetts governor, Republican governor and presidential candidate Mitt Romney's plan there. Is that one that you think Republicans can support, as Governor Cuomo was asking about? There we saw universal coverage, near universal coverage, and there's some positives and minuses to that. Is that something you support?
Well, absolutely, there are positives and minuses, and of course, when Governor Romney passed that, he admitted that it was a good plan for Massachusetts, but it wouldn't work in every state. Massachusetts was able to ignore the fact that there were some people in the state who were there without the benefit of a Social Security number. If you ignore that population and try to do the same thing in Texas, you're overwhelmed, and the program would go nowhere. The governor did work with a Democratic legislature in order to work in a bipartisan fashion. That's something we should do. do, and that's something that I would support. We get back to Washington and let's put some of the differences aside and get back and deliver something for the American people. The concept of doing away with pre-existing conditions and insurance rescissions, I support that. I don't know of a single Republican who doesn't, and maybe that's one of the things we should sit down and concentrate on and try to deliver something for those 8 to 10 million people who are really stuck with a tough diagnosis, who want insurance and find it's right now not available to them.
Congressman Burgess, thank you so much for joining us, and we look forward to having you back again soon.
Thank you.
So did President Obama jump the gun on health care? Did he take it on too soon? Tell us what you think. Log on to twitter.msnbc.com. Follow the link to my Twitter page. Click on the icon there and let me know what you think. Governor Cuomo and I will be looking at some of your tweets.